on emergencies and displacement, the role of registration and vital statistics within that context. And we are going to look at a number of successful efforts in that regard that have helped, amongst other things, prevent statelessness. We have three presentations, though four panelists. On my right is Lourdes Hufana, who is the Deputy National Statistician from the Philippines, and on her right is Agad Ligon, who is the Director of the Ideals NGO. They have a video, I understand, and a presentation in about 20 minutes to present those things. On my left, the second presentation will be from Dr. Sari Montasut, who is Thailand's representative to the ASEAN Intergovernmental Human Rights Commission. And then on my extreme left is Michael Oakeshott, who is in the same office as me in the regional UNHCR office. He's the regional protection officer specializing in statelessness. We hope to have enough time for a few question and answers at the end, but are keen to get us back on track and in time for the next session. So with that, if I could hand over to Lourdes and Agad. Thank you.
Project is very much important, and it is one of the perhaps least needed as at this moment.
Salamat po. Kay aron ko makaisila siya po kung sa CRVS, nagiging siya lang.
For those students, I mean for anyone, ang dami namin na tutulungan, umalis sila na masaya sila.
I'm Lourdes. I'm the interim assistant national statistician of the Philippine Statistics Authority, and I'll be doing the second part of the presentation, overcoming the effects of Super Typhoon Yolanda. So, the targets for the project is to deliver 83,700 civil registration records to survivors of Super Typhoon Yolanda. It also aimed to provide legal services to some 8,000 individuals who needed legal documents such as affidavits in order to reconstruct their identities. So, we partner with UNHCR, with the Department of Social Welfare and Development, with the local civil registrars, and with the local government units for this project. We did mobile registration and we conducted legal missions. We have mobilized around 200 community facilitators and lawyers to reach out to remote areas. We also mobilized government resources, such as the waiving of the registration fees for civil registration by enacting ordinances. The Philippine Statistics Authority did reconstruction of documents destroyed during the typhoon, PSA being the central repository of all the records. So we were able to help civil registrars whose records were destroyed, and we also issued omnibus certification so that we will know whether the beneficiaries were registered or not. And if not, they use the omnibus certifications for the late registration. The Department of Social Welfare linked with other organizations to facilitate benefits and claims of beneficiaries of the project. And we did capacity building for local civil registrars to facilitate registration of undocumented victims. Also, we provided equipment such as computers and also typewriters, and we provided additional staff to do mobile registration and also to do reconstruction of documents. So I will give you now IGAD for the last part.
Yes. Good afternoon, distinguished guests. I would just like to showcase some of the how we overcome the challenges during the typhoon Yolanda, during the implementation of the project. Well, for the past 5 years, you will note that the Philippines has been what we call a new normal in a phenomena of what we have storms coming in and out of our country. So the recent typhoon has devastated It's supposed to be not dead by PowerPoint, but unfortunately it's not working. Okay, so just overcoming challenges is like around 1,959 transmission facilities were damaged. Around 3.4 million families or 16 million individuals were affected by the typhoon. 1.1 million houses were damaged, and around 18 billion worth of damages to infrastructures, roads, bridges, floods, health facilities, and schools. This is around $500 million. That is around 140 municipalities that we have seen some washout documentations. We also see the problem of communications and connectivity, insufficient data, and lack of supporting documents. Massive destruction of infrastructure and inclement weather. After Yolanda, we still had 3 typhoons back then, which also hampered the mobile civil registration project that we did. For us, one of the accomplishments is the 83,700. The target is 83,790, but we produce around 126,000. What is surprising here that the 35,141 of which comes from 18 to 59 years old. So in the Philippines, there's probably, during that typhoon, there are a lot of Filipinos who were not able to register themselves, or they do not have civil records. So we also have targeted 8,000 individuals, but we were able to reach 10,000 people to provide legal services. Now, why do we do legal services? Because when you do civil registration, mobile civil registration, usually this pertains to legal documents. So these legal documents, you have to reconstruct these legal documents. And documentation really it requires a legal instrument. So we have to bring in lawyers and paralegals during that time. So we also had some public awareness on civil registration, like radio program, social media, and website. I think yes. Yes, sorry. Ways forward, right now, under our UNICEF, our partnership with UNICEF, we are now covering children and their families, indigenous peoples, and women. We are now mainstreaming CRVS in disaster risk reduction through the disaster risk reduction programs of the local government units. And we are linking CRVS to social protection by including micro-insurance when we do mobile civil registration and providing financial inclusions efforts along this line. Yes. I think that wraps up my presentation.
Very good, thank you very much. And now to speak a bit from the Thailand perspective, and I think more in terms of the policy level, Dr. Sari.
Good afternoon. It is my great pleasure and honor to speak here, and I would like to thank the organizers, especially the UNHCR, for extending the invitation to me. I have to say that I have reviewed documents that will be considered and negotiated at this conference, and have found them to cover already the subject matter on which I will be speaking. My purpose, therefore, will be to highlight and present a reflection on the issues that I consider priority areas or additional points for your consideration. The PowerPoint will cover 3 main issues, but before going into the PowerPoint itself, I have 3 main points to highlight. The first point is birth registration is a birthright of every child, the deprivation of which is most acutely felt by displaced and undocumented children. It is a human rights issue and requires a human rights-based approach. Most pertinently, as already outlined in the draft Regional Action Framework, the principles of equality and non-discrimination must be observed and mainstreamed in all stages of the process. Secondly, in the ASEAN, and especially continental ASEAN region, Thailand has achieved a good degree of success in providing and implementing birth registration program for all children born in her territory. Still, more can be done. 2 practical reform measures can be undertaken which do not entail structural change or significant resources. The first is the introduction of a dual language registration form, as well as birth certificate that is instrumental for recognition of people, especially displaced and migrant children. The second is enhanced ICT system that accommodates such a dual language documentation and facilitates cross-border recognition and registration. Owing to the key position Thailand has played in this region, our leadership role in rolling out structural reform, such as legislative changes, and engaging with neighboring countries to enhance their capacity and create a more synchronized ICT platform that will foster a common standard for birth registration. Third point, it is apparent that the issue of birth registration increasingly transcends national borders and invariably poses regional implications. While it goes without saying that it deserves and requires a regional approach, such as the ASEAN Registrar Network that results from the ICHA's cooperation with the UNHCR, the bottom line is that such an approach should be supplemented by national and, importantly, bilateral action, which will aid in the concretization of the regional plan of action. First PowerPoint, please. Can someone... I'm sorry. Oh, it has to be loaded. Thank you very much. The first main point is that civil registration is key in ensuring access to rights. We're all aware of this. I would just like to highlight 2 or 3 points. That civil registration often facilitates access to human rights, political and civil rights, as well as economic and social rights. Birth registration can be fundamental to the protection of children because it helps to establish legal identity, facilitates access to services, prevent children being incorrectly treated as adults, and can facilitate family reunion and durable solution for displaced persons. Thailand is noted in amending its Civil Registration Act in 2009 that reverses the 1991 provision which precluded the birth registration or birth certificate to be granted to children born in Thailand to parents who were not Thai nationals and who did not have permanent or temporary residence. Under the amended law, every child born in Thailand must be registered at birth and be issued with a birth certificate. This was retrospective in application. The measure led to Thailand's revocation of its reservation to Article 7 of the Convention on the Rights of Children in 2010. The second main point is that civil registration is key for population management, and there are successes that can be observed in Thailand. The first is that birth registration of previously unregistered communities, for example, asylum seekers and refugees in urban areas, and those living in the temporary shelters in border areas and stateless persons. We already have used ICT to fill the identified gaps by setting up an electronic link between hospitals to civil registries automatically to transmit birth notifications. There are remaining challenges for Thailand as well. I have, in my capacity as the representative for Thailand to the ASEAN Intergovernmental Commission on Human Rights, I have the pleasure of co-hosting a regional workshop with the UNHCR on the subject of birth registration in Bangkok in September this year, where the draft benchmark and indicators for universal birth registration was discussed. While the benchmark and indicators are set for the regional level, a number of country-specific issues were raised. For Thailand, the 2 issues that I previously highlighted, namely the introduction of dual-language birth registration and certificate and enhanced ICT system, were advocated and proposed to be included in the outcome document. Other areas of reform can also be considered, including providing incentives by removing late registration fee, which currently stands at 20 baht. We can also try to overcome fears about civil registration amongst communities with irregular immigration status and further improve the registration of birth of children who are in the position of irregular migrants. Additionally, the transcription of names is often a difficulty in border areas, which can mean that civil documents issued are not effective in proving identity. And lastly, while the legal framework provides that every child born in a hospital in Thailand is entitled to a delivery notification and a subsequently birth certificate issued by district officials, the legal framework is sometimes misunderstood by district officials. My last point, and this is my main point, is on regional challenges which can be met through regional cooperation. On regional challenges, I would like to begin by stating 2 simple facts. First, the rights of the child are one of two commonalities in terms of human rights among the 10 ASEAN member states due to their ratification to the 1989 Convention on the Rights of the Child. The other commonality is the women's right by virtue of the complete ratification to CEDAW by ASEAN member states. More relevant to our discussion is the fact that on the children's right to be registered at birth that is protected under Article 7 of the CRC, there is only one explicit reservation by an ASEAN member state. In practical terms, however, there remain a number of gaps that prevent full realization of this right throughout the region. Secondly, there are increasing levels of migration between ASEAN member states and within the wider region. The International Labour Organization estimates that intra-ASEAN labour migration increased from 1.5 million workers in the early 1990s to 6.5 million in 2013. This upward trend is set to continue through the establishment of ASEAN Economic Community later next year. There are two main goals for the comprehensive ASEAN-wide birth registration. The first is the potential for harmonization in civil registration and identity management regimes. And the second objective is the comprehensive birth registration will facilitate increasing levels of migration between ASEAN member states and within the wider region, and also the establishment of legal identity of all children, particularly the displaced and previously undocumented, will help them realize fundamental rights and access development. There are significant gaps in the region as well. Firstly, there are differences in civil registration and identity management regimes among ASEAN member states, particularly language of civil registration documents, despite the fact that English is the working language of ASEAN. In practice, many official documents of ASEAN governments only use national languages. This is why many people, including myself, have advocated for the use of dual language birth documentation akin to passport and driving license that can already be used throughout ASEAN. Second point is, another big gap is the lack of distinction, and I think that has already been reflected among the audience. The lack of distinction between birth registration and acquisition of nationality. It is true that the right of children is a common element for ASEAN, and on the right to birth registration, there is only one explicit reservation by a member state. In reality, this right is still far from being fully realized due to political sensitivity surrounding birth registration, which is viewed as an automatic bestowment of nationality. I learned this firsthand when a project on birth registration for all children in ASEAN was rejected to be pursued at the regional level. I think we have to raise an awareness not only to the difference between the two processes and the fact that it is in the interest of every government to have everyone in their territory registered and be accounted for the purpose of population management, which will help mitigate many illicit activities, including human smuggling, trafficking, and trade in narcotic drugs. As I stated in the beginning of my presentation, the deprivation of birth registration is a human right problem. And since for ASEAN this is a problem with regional implications, it requires regional approaches for solutions. There are a number of positive signs that many regional approaches are being developed and implemented. This conference is a good testament of a platform for regional solutions. The creation of the ASEAN Pacific Registrars Network, which is the result of the cooperation between the ASEAN Intergovernmental Commission on Human Rights and the ICHA, is another viable option. My message on this point is of suggestive nature. As I said earlier, I believe that to see tangible results, regional approaches on birth registration should be supplemented by program of actions in the national and, more importantly, bilateral levels between neighboring countries. I like to use the example of trafficking, in which there is a proliferation of efforts in many levels, from the Bali process at the regional level down to the bilateral agreements in the form of MOUs that are signed by a number of governments, especially in the continental ASEAN area. Through such bilateral framework, we can facilitate peer-to-peer capacity building programs, establishment of common transcription system, and hopefully linkages of ICT system that is crucial for the registration of displaced and migrant children. I am much heartened to know that the Ministry of Interior of Thailand is contemplating the use of a dual language birth documentation. Perhaps we can also think about linking that system with our neighboring countries and help our neighbors to create the same, to ensure that children who cross our borders will have documents and, more fundamentally, their identities that are recognized across our lands. More the other caution is the mainstreaming of human rights-based approach, as already reflected among the audience. While already the draft framework stipulates the principles of equality and non-discrimination, we must strive to ensure that these principles are truly observed in the implementation of the policy to be adopted here. I'd like to end my presentation by saying that while my mandate covers human rights in general, I see the rights of children as an important target, and I stand ready and willing to cooperate with you to further strengthen our capacities to help our children, who are the future of our community. I wish this conference great success. Thank you very much.
Thank you very much, Dr. Suri. I think the challenges you framed and the solutions you framed, possible solutions, were framed extremely well. Thank you very much. Nick.
Thank you very much, Alistair. I'm just waiting for the PowerPoint to come up. Excellent, it's there. Excellencies and distinguished delegates, I would like to compliment will try and complement the previous excellent presentations by discussing the importance of civil registration for UNHCR's populations of concern, with a focus on this region, the Asia-Pacific. Much of the information in this presentation comes from the emerging findings of a survey that UNHCR's officers have been responding to, covering 18 states within the region. More details of the findings of that survey are found in a briefing note which is available to be picked up outside the conference center, this conference room. I invite you to pick up a copy after the session if you're interested. As you are probably aware, UNHCR's protection mandate extends to asylum seekers, refugees and stateless persons. As we have heard of in the case of the Philippines, in some circumstances UNHCR's protection mandate also extends to the situation of internally displaced persons. But what role can civil registration play in the realization of that protection mandate? Well, last year UNHCR's Executive Committee, which is a body made up of around 90 states, and is responsible for providing guidance to UNHCR on its programs, adopted a conclusion on civil registration. Key elements of that conclusion help to answer this question about how civil registration can help in UNHCR in the exercise of its protection mandate. First of all, the Executive Committee noted that birth registration establishes the child's legal identity by creating a permanent legal record of child's existence. This is a point that Dr. Suri has already made eloquently. This is particularly important for children who are born abroad because their parents have been displaced by, for example, conflict. Without registration in the country in which they were born, refugee children born abroad risk being left without the crucial recognition that they are a person with a name, with parents, and usually with a nationality. Secondly, birth registration and the provision of birth certificates enhances child protection. As you are all aware, depending on the national legal framework, civil documentation issued to registered children can help to facilitate access to, for example, healthcare and education. It can also ensure, as Dr. Suri pointed out, that they are not wrongly treated as adults in court proceedings. Thirdly, birth and death registration and certification can be very important in the context of the voluntary return of refugees. Related civil documentation can help prove property or inheritance rights for returning refugees. In short, it can help vulnerable children rebuild their lives on return. Fourthly, a key aim of UNHCR's mandate is preventing statelessness, although this issue is often, as Dr. Suri pointed out, controversial and sometimes misunderstood. Although registering the birth of a child does not result in the child automatically acquiring nationality, it does provide a record of when and where a child was born, and often their parents' nationality. These are the usual links by which children acquire nationality at birth under the nationality laws of states. Birth registration, therefore, has an important role to play in preventing statelessness, although of itself it does not grant nationality. Finally, UNHCR's Executive Committee noted that, as in other policy areas, vital statistics generated from registration help in humanitarian planning. So how is UNHCR realizing these goals and these ambitions? Well, increasing levels of birth registration amongst UNHCR's population of concern is a key goal of UNHCR's Child Protection Strategy, which was launched in 2012. Indeed, now, increasing levels of birth registration, particularly amongst refugee children, is one of UNHCR's global strategic priorities for the period 2014 to 2016. So how does this relate to the Asia-Pacific and the situation that we find here? Well, turning to the emerging findings of UNHCR's study on birth registration globally, in the Asia-Pacific, the data provided across 18 states indicates that there are some successes. There are a number of states, however, where refugee children appear to be at higher risk of not having their births registered than other children. This is likely, it seems, also to be true for the children who are also of UNHCR's concern. Now, how does this fit with the international legal framework that Dr. Seri also identified? Well, it's important to note that the key provisions in the international legal framework relating to birth registration have been universally endorsed by ESCAP member states. They require that the births of all children are registered regardless of their legal, social or economic status. Now, it is true that there is one member state that has a reservation in respect of the Article 7 of the Convention on the Rights of the Child. But I'm happy to say that that member state's domestic law says that every child born in their territory should have their births registered. So that registration doesn't actually have an effect on the practical application of domestic law in that country. UNHCR's research in the region also identifies that the majority of states have national laws which requires that the births of every child on the territory are registered. And this fits well with one of the goals of the Regional Action Framework. UNHCR's survey also identified a number of areas of good practices which states had adopted in this region, particularly to try and address issues relating to the registration of refugee children. So, for example, as we've heard in the case of Thailand, there was a recent law reform by which previous exclusion of non-national children from birth registration was reversed and also applied retroactively. This amendment and improvement and harmonization of the legislative framework with international legal standards is an important example. But there are many other states within the region which have taken similar or even more improved steps. So, for example, in the case of the Philippines, there is no longer a charge for late registration of children's births. This is particularly important for displaced populations because they are often in an economically disadvantaged position, and therefore late registration can act as a barrier to birth registration. In addition, a number of states within the region have adopted awareness-raising measures amongst marginalized and hard-to-reach communities to try to ensure that the importance of birth registration is recognized by parents and communities. We've seen excellent examples of this in the context of Malaysia and in the context of India, with a focus on UNHCR's populations of concern. In addition to that, support given to mobile registration teams is particularly important to the registration of UNHCR's populations of concern. Well, why is that? Often our populations of concern are living in border areas. They're remote and far from civil registration offices, and in that context, mobile registration becomes particularly important. UNHCR has welcomed the cooperation that it has undertaken with NADRA in Pakistan to set up pilot mobile vans to facilitate civil registration for the many refugees and their children that Pakistan has hosted over a large number of years. Finally, the survey revealed that there were examples of the mainstreaming of civil registration within social service provisions, such as healthcare, that are particularly effective in reaching the hard-to-reach and marginalised. Examples of that come, as we've heard already, in the case of Thailand, but also in the case of Myanmar, where the civil registration provisions are integrated within health provision, maternity provision in hospitals, but also for traditional birth attendants who are helping with home deliveries in rural areas. In conclusion, UNHCR's populations of concern are particularly at risk of being left out of the civil registration picture. However, states across the region have taken effective measures to address this issue, both at the level of the international and national legal frameworks, but also in terms of practical measures that have been taken to address these challenges. The decade of civil registration and vital statistics offers an opportunity to make further progress in this area. As this is one of UNHCR's priorities and as one of the partners in this initiative, we would welcome the opportunity to contribute to that endeavour. Thank you very much.
Thank you very much, Nick. We've got a little over 10 minutes left for questions and answers. I think we've had very good examples of the policies that we'd like to see, ways to come at them, and good practical examples of practice already happening. Let me open the floor. Yes, I can't see the nameplate.
I'm not. Yes, I'm a country representing planning department. My question is regarding the state's shyness of adopting the refugee concern things into their national frameworks and national registration campaigns and things like that, because they fear that by doing registration of the refugee and stateless children planning, perhaps it will constitute to giving them the state's citizenship adoption. So what the refugee, UNHCR or ESCAP is doing to bring them to this human rights issues and of the refugee children, because they, and through this conference and through bilateral and multilateral arrangements, refugee and stateless children planning, perhaps.
Are there other questioners? Yes, India, please.
This question is in the context of large-scale natural disasters where a large number of people are washed away, or, how do you have a system of presumption of death? Otherwise, the normal legal systems would mandate a period before, or they would have to have the physical evidence of death or the body over there before you could give a death certificate. So my question is to Philippines, was there any system where you could issue temporary birth certificates on the presumption of death when the dead body was washed away because of a cyclone or because of floods or maybe the tsunami?
Sorry, let's take those questions in reverse order then. I think Philippines can respond to that one, and I'll open it up to both gentlemen.
We do not issue temporary death certificates. We have a procedure on how to register. We call this mass deaths, and we have a procedure on registering mass deaths. One is we know who the residents are of the place, so we go to the Commission on Election to get information on the list of residents in that area, or if the barangay captains have survived the typhoon, then the barangay captains can issue certifications as to who are the residents of this. And based on this, they can prepare the death certificate, but of course, we cannot register that without the approval of the local health officer. Although somehow we have relaxed some of the procedures. And as long as they can comply with the special procedures, then we will register as death, but not as temporary death.
It's not a conditional death. I shouldn't laugh about such things. Would you like to take a shot at the earlier question?
Certainly, thank you, Alistair. I think that it's very important, first of all, to see a clear distinction, as was previously identified, between civil registration on the one hand and the acquisition of nationality under the nationality laws that states have. That distinction is crucial. What are the ways in which a misunderstanding of issues of the acquisition of nationality can get in the way of civil registration? Well, basically the problem is that in this region sometimes it is misunderstood amongst communities, but also amongst those implementing registration, that the registration of birth, for example, automatically grants the child the nationality of the state which is registering that child. In this region, that is very, very unlikely, because the vast majority of states, and we've been analysing the nationality laws of states in this region, grant nationality on the basis of descent, so on the jus sanguinis model. So in those circumstances, a child simply being born in the territory of the state is not going to mean that the child acquires nationality. And one of the things that we discussed at the workshop that Dr. Siri mentioned in September was how to try to address this issue to make sure that the distinction between civil registration and the acquisition of nationality is understood, both by those that are doing the civil registration, as one would expect, but also by the communities, and so that they themselves do not have false hopes or expectations about what registration can actually mean. So those are the steps that we're thinking of taking in order to address those issues. I don't know if you have anything to add.
Just to add the point that when people confuse the two processes, it often leads to the denial of birth registration altogether. And this results in many illicit activities. I've highlighted human smuggling, human trafficking, and also illicit drugs. And when people the problem is especially acute in continental ASEAN, because a number of states come up with that kind of misunderstanding and do not allow, in the first place, birth registration, with the fear that it would lead automatically to the granting of nationality, which is not the case. I think we have to, again, reiterate what Nick has related to us, make clear that distinction. Thank you.
If I could turn now to the delegate from Armenia.
Во-первых, excuse me, I speak Russian. Я, во-первых, хочу поблагодарить за столь интересные презентации, потому что у вас очень презентации, если возможно, бы дали, чтобы уже наглядно показать ваш опыт работы. У меня один вопрос относительно смертности. Имеется ли какой-либо механизм в ваших странах, который проверяет качество данных по смертности, то есть как кодируется смертность? Если имеется какой-то механизм или какой-то опыт, как вы проверяете качество данных, было бы, конечно же, желательно услышать и об этом. Потому что очень часто бывают ошибки, связанные с кодированием причин смерти.
I take it that's to the Philippines, yeah?
Yeah, for the cause of death, yeah, when we registered death, if there is an attendant at death, then the attendant or the physician will be the one to certify as to what the cause of death is. But this cause of death that was entered by the doctor or by the attending physician will be reviewed by the local health officer, who is a government physician. And then the local health officer will have to approve the cause of death given by the certifying officer before the death certificate can be registered. So there is a way actually of validating the cause of death. Yeah.
I would also like to add that during that time, there were also a number of fatalities that were brought to the mass grave that was not registered. Actually, we cannot provide any death certificate because they do not have birth certificate. So somehow that becomes a problem. So we come in with legal assistance by providing legal documentation, facilitating their civil records, and only then we can register them as death. So that's how we usually do that during that time.
Let's see, any last questions from the floor? Seeing none, and having got us back on time, almost seeing none, Tajikistan.
Производится ли перерегистрация граждан Таиланда, родившихся за рубежом? Ребенок родился за рубежом, получил свидетельство о рождении. Это в Таиланде производится перерегистрация. Видите еще свидетельство Таиланда.
I think short answer would be yes, but late registration fee would apply, and that's what we have advocated for, the abolition of that kind of registration. But technically, you have to check with the people among the Thai delegates. I can only say from my point of view, from the broad legal framework, that we do register people born abroad. The system allows for that. Thank you.
Very good, and thank you very much for the questions, and thank you very much to the panelists for joining us for this special session, and that will wrap it up.
Excellencies, distinguished delegates, ladies and gentlemen, thank you to the speakers and delegates for another highly informative special session. It is now time for a short break for